This show is supported with a grant from the Claude Worthington Benedum Foundation.
From West Virginia Public Broadcasting and PRX, this is Us and Them, the show that tells the stories about the things that divide us. I'm Trey Kay. This episode originally aired in February 2020, and we're pleased to announce that it was just honored with the National Edward R. Murrow Award. Here's a scene that plays out millions of times every day: a school bus pickup.
You have to have the matching tags for safety reasons. And because there is so many custodial issues, which I think is fabulous that they do that. This man's talking to Mama about how Mama loves you and your brothers and Mama's raising you.
The mama or grandma here is Gigi. She lives in a town near Charleston, West Virginia, and I'm with her at the bus stop where she comes most days to pick up her grandkids. We agreed not to use her last name or the names of the rest of her family to respect their privacy.
Oh, here's your bus. She loves the school bus. Last year, she used to stand here with me and watch for brothers to get off the school bus and wave at them.
We sit in Gigi's car and talk while we wait for her grandson's school bus.
His bus is going to come here, but it'll be about 40 minutes, so we can talk more.
There's a twist to this familiar scene. Gigi is grandma and the primary caretaker for her grandkids. This is a reality becoming familiar to more and more grandparents in West Virginia and across the country. Gigi's daughter, a mother of 4, has a history of substance abuse. So Gigi cares for 3 of her 4 grandchildren, ages 4, 7, and 12. Her daughter has been in and out of various treatment facilities and jail.
Tell me about how your daughter interacts with her kids.
Well, when she seems to be, on a little clean spell, she's had lots of hills and valleys, more valleys than hills. But when she does seem to be, doing better, she's been through the Suboxone program, methadone programs, drug court, safety plans, all multiple, practically everything you can think of.
Gigi says that includes court-ordered rehab treatment.
When she is clean, or even somewhat clean, there's times you can tell she's worse than others. She's wonderful with them. She, hugs them and plays with them and, wants to take them to the pool, to the park, or go for a walk around the track and watch a movie, pop popcorn, does little crafts with them. She's great with them. But when she's messed up, when she's really using, it's like, none of this matters. All her next focus is, and I've heard this from multiple people. Psychiatrists and nurses that work in behavioral med units, that when you're addicted, nothing is more important. Not your mother, father, children, nothing comes before that next fix. That's all you focus on.
The opioid crisis has divided millions of U.S. families. Some families split along generational lines, causing an us and them within a single household. In other families, underlying financial issues bubble up, causing a strain between parents and their adult children. More than 2 decades ago, pharmaceutical companies created opioid medication to relieve pain. Widespread use and misuse uncovered its addictive qualities, but not before millions of people, like Gigi's daughter, were hooked. And we'll hear more about her a little later. In 2017, the U.S. Health Department declared the opioid crisis a national health emergency. The families of opioid addicts now face a new set of consequences. It's a generational us and them.
They were seeing a trend in statistics of an increasing number of grandparents taking on the responsibility of raising their grandchildren.
and Bonnie Dunn sees that up close. She works with family support programs through West Virginia State University, and she's watched the opioid crisis hit Appalachia hard. Along with Mississippi, Arkansas, and Kentucky, West Virginia has one of the highest numbers of children who live full-time with their grandparents.
It looked as if the opioid crisis was driving that.
Dunn says it was time to step up and fill a need for communities across the state. So she helped create a program at West Virginia State University called Healthy Grandfamilies. 10 weeks of free classes provide information and resources to grandparents and great-grandparents who are raising their grandkids at a time when they were expecting to retire. More than 2.5 million children in the U.S. now live with their grandparents, relatives, or close friends. The Annie E. Casey Foundation reports that's nearly an 18% jump in the last decade. Federal money pays for West Virginia's Healthy Grandfamilies program. It all started when Dunn and a colleague applied for a grant to study the concept of kinship care.
I like that term, kinship care, meaning, is that like another term for kind of like skipping a generation?
Well, kinship care basically is aunts and uncles and cousins who are raising children that are not theirs.
They got the grant. However, there was one request: to focus solely on grandparents and grandfamilies.
The reason USDA wanted us to pull grandfamilies out and do a study on them alone is because it's a totally different dynamic. I can be an aunt and take on my sister's children. That's one thing. But if I'm the grandmother and I take on the grandchildren, the dynamics of the relationship changes.
Why is that?
It's because going to grandma's house was always lots of fun. I went there, I got sugared up, could stay up late. What happens at grandma's stays at grandma's.
How did you know in 2015 that it was a problem or that it was a challenge that West Virginia needed support for grandparents who were raising their children's children?
Well, simply through what the U.S. Census was saying. You know, if a state is in the upper 5 of a problem, in the negative, then there's a problem.
I attended the first session of Healthy Grandfamilies training in Hinton, West Virginia. About 15 or 20 people mill about the dining area of Hinton's First Presbyterian Church. Doris Selko works with the Family Resource Center that facilitates the Grandfamilies training.
There may be a few people coming in. We do have a few people that we're anticipating coming. This is our very first meeting, and we are going to try to really get involved in the program as soon as possible. So what I want you to know, first of all, is we're going to meet here every Wednesday for the next 9 weeks.
An employee with West Virginia University's Extension program presents the first lesson on the topic of relationships and communication in the 21st century.
Communications, a lot of times, I think that we all want to communicate effectively, and I think that we want to have healthy relationships. I think some of the time our communication, though, because we have different personalities, we don't quite meet up in the middle, and we just barely miss each other.
The program also teaches grandparents how to interact with someone who has an addiction. Dunn says some find it tough to see their adult child as an addict. She recalls a class where the instructor had to explain how a woman was enabling her daughter's addiction.
We have a story that the grandmother of the child was in addiction, and she was in recovery, and they invited her to come and attend a counseling session with the child. And she has one grandchild from that child. And they told her that she was and had been an enabler. And she said, I don't know that term. I don't know what that means. And I know this grandmother was a very intelligent lady. But if you're not in the world of addiction, if you've never been exposed to it, if you've never read up on it, then chances are you don't know what that is. And so she said to them, I don't know what you mean. What is an enabler? And so they explained it, and she just politely looked at him and said, and I thought I was just loving my child. When my child needed $20, I gave my child $20. Never crossed her mind that the $20 was for a drug fix. And she said she learned so much from that, and she learned a lot from the program, because in the program we talk about the family response to addiction, because these families are not equipped to handle this new world of addiction that they've been thrown into.
Since the Healthy Grandfamilies program got its start 5 years ago, it's become a success. It's been implemented, or will be implemented, in all 55 of West Virginia's counties. But Dunn says in the beginning things were rough. It took a while to get off the ground because they couldn't find grandfamilies. The grandparents were hiding.
Our adventure of recruitment was very difficult. I've been doing this type of work and community-based programs for many, many years, and I never had problems getting people to come to a program. And I used every recruitment method that I had ever used in my entire life. Nothing was working. So I had to back up and punt. And I was doing a presentation one day, and someone from pre-K office in Kanawha County Schools was in there and came to me and said, I'm just really moved by this concept and I want to help. So the way they began helping was we would do a flyer about the program, and they would send it out in all the schools, and they would put it in the children's backpacks, and they'd take it home.
Dunn says this low-tech recruiting kick-started the program, and once it was going, they were okay.
These grandparents felt like if they even started looking for any type of social service, take, for instance, the most common is food stamps, the SNAP program, Supplemental Nutrition Assistance Program. If I go and try to get SNAP benefits, that's going to alert somebody they need to come in and check on me, because why do I have these children all of a sudden? And am I fit to raise these children? Is my home good enough? Is it clean enough? Is it large enough?
Some grandparents worry if they ask for help, it will show up as an admission to child protective workers that they aren't up to the responsibility. Dunn says they also feel a lot of different emotions: fear, shame, even pride. Many grandparents feel like they failed as a parent and wonder how to do a better job the second time around.
As I was preparing for that very first session on parenting, I was extremely humbled to think that I'm going to go into a room full of people who have raised their children and who have found themselves in this situation. And I have parented and raised 2 children, and by all accounts, I guess successfully. At least my son tells me I got lucky. But going into that class the first time, I kept thinking, what do I say to these folks? And the thought came to me, must have not gotten it right the first time, or I wouldn't be here doing it the second time. And I'm a woman of faith. I did a lot of praying about that. I thought, is this what I want to say to them? And so I stepped out and said to this in the context, I said, folks, I just want to get the elephant out of the room, because you are heavy burdened by what's going on, and I feel as if you think that you must have failed the first time around or you wouldn't be doing this. And the tears flowed, and I knew that I had hit the nail on the head.
Dunn says these families have been through a lot. Their relationships are stressed by the challenges of addiction. The training sessions emphasize that communication is one of the most important tools when trying to build or rebuild a relationship.
Communication involves openness and honesty, even when it's difficult. Our communication can always be improved. So even if you have a great relationship with a grandchild, it can always be improved, and it really is the key to healthy relationships. So if you have questions, I'll be here. But
Do you remember Gigi? We met her earlier when she was picking our grandkids up at the bus stop. Her daughter has battled chemical addictions for years and was recently seriously injured in a car crash. While we sat in her car, she told me how things have been. Gigi just turned 60, and I asked her what she thought her retirement was going to be like.
Oh, I have no retirement left. Yeah, I mean, I didn't have a whole lot. And then, what I did have, I've had to cash in, so many times for this, that, or the other. I even had to voluntarily repo a car because so much changed when, with the death of my late husband and, the difference in our income and everything. I just couldn't make the car payments. I mean, I struggled and I just didn't have enough money. And so I voluntarily turned it in. So now I've got a big suit against me on that. And it took me a while to get any assistance from the state. And from what I do get, it's not nearly adequate compared to, if I adopted them. I understand I could get way, way, way more.
Right now, Gigi receives $374 a month in caregiver pay. That's total for all 3 kids. She was getting SNAP benefits or food stamps up until a month ago. But then she started drawing survivor benefits from her late husband's Social Security. Now Gigi's income is above the limit to receive food assistance. I asked Gigi, what's stopping her from adopting her grandkids? Turns out, it's her daughter.
She refuses. She said, I will not sign over my parental rights.
Does she resent you?
I think she does. In some ways she does, in some ways she doesn't. She says I brainwashed the oldest one against her.
When you're 70, you're going to have teenagers and somebody college age. How's that look to you?
No, I just keep on going. I just do everything I can to try to take care of myself and to try to, that's why I had to quit my pharmacy technician job because of the crazy hours at the hospital and, long hours, mandatory overtime, mandatory different shifts. I've just always loved my grandkids so much that I just, I knew it'd be a huge sacrifice. I knew it'd probably be difficult, but I thought, their happiness, their being together, because, I also think that with her health and the way she's going, who knows how much longer she's going to be around.
So I'm here. This is a pretty big house, and I just want to make sure that I understand. Are you tending to these 3 children alone? Do you have a partner? Do you have somebody else in your life?
It's just me. I have started seeing a gentleman that is also in a similar situation.
What do you mean?
He's raising a granddaughter. It's actually not his biological granddaughter. It was his late wife's. She passed. Son's little girl. And they had adopted her at 2 months old due to both the parents were drug addicts. And she just turned 7. And, we just kind of, when we talk, we text, we take the kids to the park, we take them out to eat. We actually went to the beach together this summer. First vacation I've been on in years. And it was just really nice, and the kids did pretty good. They were, a bit of a adjustment, but we survived it.
I asked Bonnie Dunn to introduce me to grandparents who'd benefited from the Healthy Grandfamilies training, and she hooked me up with Gigi. I completely understand why Bonnie connected me with Gigi, because it's so obvious how this situation has changed her life. She seems constantly busy, like there's never a quiet moment. Even as we sit in her car waiting at the bus stop, the kids are eating snacks in the back seat, chattering and running around outside. Gigi watches them as she talks to me about the sacrifice she makes to ensure their future together.
I don't want them split up. I don't want to lose them, because, early on when all this first started, I said, well, what if you would take them? What if they would go into foster care? Would I still have grandparents' rights? And they're like, well, yeah, there are grandparents' rights, but the kids could be divided. They could go anywhere in the state, or sometimes they even go out of state.
Gigi says her youngest grandkids don't really know what's going on with their mom.
The oldest one, he knows. And I found out that, Mommy would go in a room and lock the door, and he'd have to bang and bang and bang, finally get her attention. And to get, Mommy, I'm hungry, and this, that, and the other. And finally she'd come out and feed him. And, she never harmed them. As far as like beating them or, anything like that. But it was just more of a neglect, not caring to their needs. And, being, on the phone arguing, paying more attention to looking for a next fix, I guess, than the kids, and just doing the very bare bones minimum.
Grandfamilies training looks at the things that have changed since grandparents were first parents. In some cases, that was more than 30 years ago. Grandparents now have to face technology that they're not always up to date with.
Parents, grandparents should be monitoring a child's cell phone use because children are not necessarily mature enough or responsible enough to make the decision what is or isn't appropriate at times.
At the Healthy Grandfamilies training session in Hinton, West Virginia, there are about a half a dozen grandparents, mostly women. I meet 58-year-old Jeff, who's just started caring for his grandson. Jeff's situation is a little unique because he works in social services with a child advocacy organization. So he's used to being the one with all the information and answers. But he took in his 14-year-old grandson a few months ago. Jeff doesn't know all the details, but he knows there was drug use going on in the house. We're not using Jeff's last name or naming his family for their privacy. So Jeff is on the other side of the table now, looking for answers, resources, and more importantly, community.
What is it that you need from this training?
I need to be able to talk to somebody that's in the same situation I'm in, who's gone through it and said, do this, don't ever do this, or you want to make sure you do this. They can sit there and say there's 100 resources out there, but, this is what you need to do. It's someone who's been in my exact same situation.
And again, you are somebody who works in this field. You kind of know, or you might have a better idea of what the services are than other people, but you still feel like you need help.
I'm not afraid to ask for help. I never thought I would be in there. It's not going to happen to me. My everybody's going to be happy and healthy and everything's going to be all right. Well, now that it has happened to me, it's opened my eyes up to some of the problems that I didn't foresee. And the one that I really need is just that peer-to-peer help.
And then Jeff talks about grandparents he's met who feel like they failed. Remember the point Bonnie Dunn emphasized at the very first Grandfamilies class? She said that just because you're here doesn't mean you failed as parents the first time around. Well, Jeff said that he's heard that too.
How come my kids are on drugs? They were good students. They came from a family with, a stable home life. Why did my kids get on drugs? And then I think that's scary to think, what could you have done that kept your child from, being a drug addict? And it's all social. It came from broken homes. You could have the perfect family with the big brick house on the hill, or the kid living in the worst trailer park in town. It just seems like it's everybody. It's picked on, the drug thing has hit every home on the block.
You're a little more than a month into being the full-time care provider for your grandson. Does he need tutoring? Does he need help at school or anything like that?
When he got here, he said he did. He was struggling at his other school. But once he's gotten here, he's doing fantastic. But a whole lot different home structure. So that may have been why he was having problems before, was based on what was happening to him at his house or his environment. Well, now his environment's a positive, structured environment. That may be why he's doing better. So we're monitoring that to see if that's the case. So now we're getting to learn a whole lot more about him.
Creating a grandfamily can be a big social adjustment. Some kids stay in the same city and continue at the same school. But for others, there's a move across state lines or across the country to live with grandparents. In those cases, there are new schools, teachers, and friends. Jeff says finding people who understand, who are living it, is a relief.
Do you see this as not just a training session, but this might be some type of thing where you're going to have a bond with these people?
Yes, sir. Somebody you can call in the middle of the night and say, hey, my grandkid isn't home yet. Or, hey, they're flunking math. They were doing great. Now they're flunking. And then, of course, we saw what drug abuse did so we could get our grandkids. How do we keep our grandkids from getting on drugs so that it doesn't keep going? How do we stop this downhill roll that we seem to be on? Because if our kids are addicted to drugs and we've got our grandkids now, well, if our grandkids get addicted to drugs, who's going to watch them? So I think that's one of the scary aspects of it. We've got to stop this. Whatever it takes, we've got to stop it.
You guys do this every day?
We try to.
Jeff says every day, weather permitting, he and his grandson play basketball after school.
You got good form.
Sometimes it's just 10 minutes. The other day it was so cold we couldn't stand it. So we got in about 10 minutes and we said, that's enough for today. Sometimes it's 4 hours.
They're learning about each other. And Jeff admits that sometimes his discipline is a little too military. And he tries to remember what it was like to be 14 again. Jeff is learning to start with the positive and then get into the tougher stuff a little later. It's clear to me that while these grandparents love their grandkids, raising them is a huge stress at a time in life when they were expecting to take it easy. After a break, we'll see how social service professionals, social workers, counselors, schools, and even the state are stepping in to help support these grandparents and the struggles they have yet to face.
This is a community I chose to stay in and to be a part of, and I want to help it be a better place. And I think that's part of being a superintendent. And as long as I'm sitting in this job, I will go out of my way and do what I have to do to help these kids be successful adults and to help these families have a good experience with school.
I think that we know what we need to be doing for the present generation, but we've got to think past that. That's where it gets complex, and we've got to figure out ways to make investments that'll have a lasting impact on our state 20, 30, 40, 50 years from now.
I'm Trey Kay, and you're listening to Us and Them, which is supported in part by the West Virginia Humanities Council and the CRC Foundation. This episode is supported with a grant from the Claude Worthington Benedum Foundation.
In difficult times, music gives us peace, brings us together, and helps heal us. It calms our nerves and brightens our days. That's why we're bringing you classic episodes of Mountain Stage on air and in our podcast. This is Larry Gross, host of Mountain Stage. Find something that's familiar or brand new and feel the power of live music on our website, mountainstage.org.
I'm Trey Kay, and from PRX and West Virginia Public Broadcasting, you're listening to an episode of Us and Them that originally aired in February of 2020. It was recently honored with a 2021 National Edward R. Murrow Award. Some of the consequences of America's opioid epidemic are becoming clear. However, there's a new generation caught up in the cycle. Now, communities around West Virginia are supporting the families and children left behind when a parent struggles with addiction. More grandparents are accepting that burden, but schools, social workers, and school counselors all see the effects. I've been to a couple Grandfamilies training sessions. At one I attended last year, Bonnie Dunn talked about how instability at home can affect the kids' mood and behavior at school. This training was a little different from the session for grandparents. The focus and topics here are aimed at an audience of teachers, administrators, and social workers. They talk about the ways kids bring the chaos of their life into the classroom.
Susie Joe was in a traumatic situation last night. Handle her with care today. They don't talk about the situation or anything because that child may come to school hungry, sleepy, because there's been incidents in the home, whatever. And so that alerts the school system. This child's not misbehaving. This child's not being belligerent and everything else. This child's been through a traumatic situation.
My name is Kim Rhodes, and I am the superintendent of Summers County Schools. I grew up here. I'm a native here. I chose to stay here when I could have left, probably made a lot more money somewhere else, but I love my county. I love the people in it, and I love the job that I do. I love my job. Now, not all the time do I love my job. I don't like board meetings. They're not fun. Talking about money's not fun when you don't have any. But I do love my job and the people that I work with and the kids in it. I don't have any children of my own, but I say the good Lord gave me 1,465 of them to rear, and I enjoy it.
Rhodes has worked as a superintendent for 4 years, but she spent more than a decade as an administrator, and that helped her see trends within her community. Now she helps set up training for healthy grandfamilies.
I recognize that we have more and more grandparents caretaking their grandchildren. In fact, off the top of my head, I can tell you of 2 sets of great-grandparents in our county that are rearing their great-grandchildren.
Wow.
That's pretty amazing.
Well, let's just talk about those great-grandparents here for a second. I mean, how old are they?
They're elderly. They are in their late 70s, early 80s, and it's very difficult for them. They move slower. They have their own medical needs and issues, definitely financial needs and issues, and mobility needs and issues too, because they have to drive now when they may not want to, and they're getting up earlier when they're in the fall or the early winter of their own lives,
Because Rhodes has grown up in Summers County and has worked in the school system for so long, she's had families reach out to her directly for help. She says that this epidemic doesn't just affect one segment of the population.
Don't think for 1 minute that this is all about poverty, because there's a lot of upper middle class families, grandparents that are dealing with this now because drugs have caused them, one way or the other, their addiction has caused them to lose custody of their children, ergo the grandparents get them.
Rhodes says she's begun to see the inconsistency that addiction throws at a family. When parents are jailed for drug use, the grandparents step up. They take the kids to help out. Then, Rhodes says, when the parents get out of jail,
they want to come back and get their kids. So these kids that have just been stabilized for a year and a half, 2 years, now mom's back in the picture and she wants to do it completely different than her mom is doing it. Disrupts the structure. And then we get to feel that backlash at school, because that's where kids let out their anger and their energies and their apathies and their tantrums or their crying or their bullying, because that's how they express themselves. We knew that we had this growing population in Summers County. We didn't know that the state had also recognized this growing population of grandparents or great-grandparents. And Summers County currently, we have about 330 students being reared by grandparents or great-grandparents.
So could you give a percentage? Is that a big percentage of this?
1,465 students in our system, and 330 of them are being raised by grandparents, so you can do the math.
That's 1 in 5 students who are living with a relative. That's a lot. And outside of West Virginia, in Mississippi, Arkansas, and Kentucky, the numbers are even higher. Rhodes says the Healthy Grandfamilies classes that she teaches are basically how to parent in the 21st century.
How many grandparents understand technology? Because now we use all kinds of technology in schools. We are one-to-one with our computers, with our students. So all of our students have access to their own individual laptop.
You've told me about great-grandparents who are raising their kids.
And they're going to have to learn about social media. And they're going to have to learn how to do applications online for the camps or for after-school tutorings or whatever the service is that's being offered, even if it's 4-H camp, or we have the whole community's involved in this push or this initiative to help get them the training they need so that they learn. Basically, they're going through sort of parenting classes 21st century style.
When a child is living with a relative and the family is stressed because of addiction, how can it affect them as a student?
Every child wants their mother back. Even if they were abused and neglected, they may not even understand that they were abused and neglected because that's the norm for them. But what happens is they become behind at school because there's no involvement there with education at home. And when a child is constantly worried about things way beyond their age where they should have to worry, then they don't focus at school. And then you see that outlet of behaviors and they become behind in the school. And then we as the school system have to deal with those behaviors through discipline usually. But we're getting very creative and we're learning to look at the whole child and not just the behavior. And we're becoming a very trauma-informed school system, which I'm very proud of. And we've offered mental health services, are now offered through Raynell Medical Services in all of our schools, so that counseling from a mental health provider, not the school counselor, can now take place in the school, which means our attendance will stay up. They won't have to leave school to do that if the guardians choose to go that route.
Superintendent Kim Rhodes says grandparents may not even be aware that schools offer dental screenings, mental health assessment, and even medical immunizations. But she stresses that grandparents also need to help themselves.
They need to have their own circle of friends that are dealing with the same thing so that they all can work together and they have someone they can vent to or someone that's gone through it already.
What do you think the state government or the federal government could do to help more in these situations?
Well, I think that the Grandfamilies training is definitely a step in the right direction. I think this has been needed, and I'd like to see more of it. And I would like to see maybe the trainings, the topics broaden, expand to other things like hygiene, feminine hygiene, and what's available, what's out there. Birth control has changed so much in the past 10 years that grandparents may not know what's available. And that's a family choice, not a school choice. And they need to know what those options are.
Rhodes says there's another topic that isn't talked about much in these training sessions: the big picture money issues that affect a multi-generational family.
There's nothing in there about doing their taxes. And I think if I were 70 years old and I was getting my grandchildren, or even 50 years old, getting my grandchildren, everything about your life is getting ready to change. There's nothing in there. It does talk about stress being one of them, but it doesn't talk about coping skills are things that we would need to look at. I just think there's a lot. And why can't these grandparents also, if you asked earlier about what could the government do, maybe the government could give them a tax break. Maybe a grandfamily wouldn't have to pay taxes on this, or the copay could be waived for them because they're already on a fixed income.
Bonnie Dunn says during the 10-week program, there's more focus on connecting grandparents with financial and social supports. When people first enter the Healthy Grandfamilies program, an intake process asks them plenty of questions. What is the legal status of their relationship with their grandkids? How did they become responsible for their grandkids? And it even asks about their health and the health of their grandkids. The intake interview helps social workers connect grandparents with a variety of resources. Since every grandfamily has a different financial situation, the financial support differs. For 78-year-old Stephen, even with help, this intake process can be overwhelming and confusing.
Okay. How long have you been responsible for him?
Well, ever since he was born.
Okay, and he's 10, you said?
Yeah.
10 years old? Okay. So who lives in your house? Your wife lives in your house?
Yeah.
How old is she?
64.
So do you feel like you don't have as much time for yourself? Do you feel like You don't have privacy? Does it interfere with a job? Is it a financial burden?
No, ain't no financial burden.
None of that
Not
stuff.
for him.
No, for you.
And me either.
No. So you're feeling pretty good.
Yeah.
Well, one of the girls back here that was with me, one of us will be back every week. So if you have any issues that you want to talk to us about, we're happy to help you.
I appreciate
That's
that.
what we're here for.
Thank you very much.
It's nice to meet you. My name is Mary.
Steve.
Nice to meet you.
That's Mary Carr you just heard. She helped Stephen fill out his intake form. I asked her about the challenges of working with this population.
You know, some uncertainty about what the needs are, unwillingness to admit his own needs, and, definitely put the grandchild's needs first. Grandparents are different because they can be very prideful. They don't want to, take anything. They want to give to their grandchild, and they don't know, they don't know about all these services, and they don't necessarily want to utilize them because they're from a generation that just doesn't ask for help. We're going to have a social worker at every training so that we can sort of have an idea of what's going on, and then at the end when we follow up with them can talk more about what they've felt was good about each training and what they need help with.
When fighting an epidemic like addiction, officials realize it's not just one drug they're up against. It's heroin, methamphetamines, and even fentanyl.
We have multiple issues in our state, and really a lot of people are suffering from polysubstance use. And over the last year in particular, we've seen an increase in methamphetamine, and people are using multiple drugs. So while the federal funding has been focused on opioids, it's a bigger issue.
That's Bob Hansen, the director of the Office of Drug Control for West Virginia. His office is part of the West Virginia Department of Health and Human Services. It's designed to improve drug overdose surveillance and response. The department estimates the opioid epidemic has cost the state $8.8 billion with a B dollars. That comes from healthcare and criminal justice costs as well as lost worker productivity. As the director of the office, I asked Hansen if that surprised him.
Well, it didn't surprise me, but it just brought home that we need to do more. Fighting this crisis, we have to be on multiple fronts, and there's so much to do. I mean, there's the importance of prevention and stopping adults and youth from going down the path of becoming addicted to different illegal substances. And there's the path of reducing overdose fatalities, which is so important. There's so many things that we need to do. This is a big area in addition to all the other things that we need to focus on.
One thing that can be surprising about the effects of addiction is the burden it places on extended families. There's a lot of research that's sprung up on that topic.
Do you see this as the beginning of expanding the need for this kind of assistance?
Well, I think it's the beginning of doing a lot more. I think it's a good starting point, and I think we need to be researching how we can provide support to extended families as well as to the children. We're unfortunately at the epicenter of this type of an issue, but we really need to address it. And to address it, we're going to have multiple agencies and different people, be it through education, obviously the Bureau of Children and Families, and all sorts of groups need to get together and collaborate to come up with effective strategies. And that's, I think, something we are doing, but we need to do more of.
What do you think of this Healthy Grandfamilies initiative that was started by Bonnie Dunn?
Oh, I think it's super. And it shows some resilience in West Virginia to develop supports and recognize an issue and to begin to address it kind of from a grassroots basis. So people like Bonnie need to be commended. They're passionate about this, and that's what we need to be supporting, and the people we need to be working with to improve the situation. So I think that's a good thing about West Virginia. We have people like Bonnie who really step up and identify an issue and really get involved, and we need to carry that forward.
As I've talked to grandparents who are raising their children's children, I've also seen multiple references that place West Virginia and Appalachia at the center of a new family structure. I asked Hanson why.
We're a family-based culture, and Appalachia is, and I think that is part of it. And the commitment of all of us to our extended families is part of it. You take that kind of cultural thing that we've had for centuries, and then you take this opiate epidemic, and it's kind of a natural extension of families helping families and stepping up to the plate.
Are there ways we can help shape the national response to this generational crisis that this opioid addiction creates?
Huntington was the epicenter in the country about the opiate problems that day in 2016 when we had so many overdoses. But now the city of Huntington and Marshall University are showing success in promoting Huntington as a city of solutions. And I think this is a similar situation. I think while we have a crisis, while we have a serious problem, and also we have to look at it as an opportunity to come up with solutions and also share those solutions with the rest of the country.
In 2019, there was a $260 million settlement against 4 drug companies blamed for the opioid crisis. West Virginia Attorney General Patrick Morrisey struck separate deals with 3 of the companies that give the state more than $70 million. Hanson says they're still figuring out how the money will be spent, but he agrees they'll need to focus on future generations.
We have to pay attention to the multi-generational impact of the epidemic and figure out strategies to support these multi-generationals and really break the cycle of addiction and support families going forward. It's going to be a challenge to use settlement funds wisely so that it has a lasting impact on our state.
Just to kind of break it down, it's not necessarily a situation of we have basically a generation of people who are in the grip of addiction, that it's not just them who we need to address their problems and their concerns, that there's many more people from this moment. You're shaking your head.
Yes, that's going to be the challenge. I think that we know what we need to be doing for the present generation, but we've got to think past that. That's where it gets complex. But I think the challenge to those of us who will be, dealing with settlement issues is look at the bigger picture, look at the longer term, and we've got to figure out ways to make investments that'll have a lasting impact on our state 20, 30, 40, 50 years from now.
We want grandfamilies to be productive so that they raise productive citizens. I'm concerned about who's going to be running the nursing home my kids stick me in. That is funny, but I'm serious. What's the workforce? Because is that not what we do in education? We are trying to prepare the workforce for the next generations to come.
Right now, extended families and grandparents are the first responders when children lose their parents to addiction. People in their 60s, 70s, and 80s are taking on full-time custody of young children. These grandparents are responsible for the next generation. For many of these families, it's easy to brush off the stress and strain of the situation because the grandkids are happy and safe. But Bonnie Dunn reminds grandparents their health and happiness is vital as well. Bonnie remembers one grandfather who looked like Santa Claus.
We have this little stress test that we give them. It's a numerical test, and they add up their scores, and then they see where they fall in these categories. I should have called 911 that day and had him take him to the hospital. He blew the thing off the chart. He scored higher than anybody I've ever had score. And so I said, okay, Grandpa, what does this tell you? Well, it tells me that I guess I just didn't recognize the pressure and what I'm going through. And I said, and you know why? Because you get up in the morning and all you are thinking about is that little girl. You're not thinking about you. You're not even thinking about what you need, because this is what we see with these families. They're so immersed in the needs of the children, they're not taking care of themselves.
My conversation with Bonnie Dunn about this incredible responsibility reminds me of when airline flight attendants tell you, if there's an emergency, secure your oxygen mask first, before you help others.
The moral of the story is we realize it's a lot of work to take care of these young children, but you have got to take care of yourself so that you are healthy enough and you live long enough to raise these children. And so the whole premise of the program is more about the grandparents, but then by helping them, we are helping the grandchildren. But we want these grandparents to be as healthy and successful as they can be, because if we don't, I'm asking the state of West Virginia, what are you going to do with all of these children when these grandparents can't take care of them? That's my message. That's my question, my challenge to the state. What are you going to do?
You've been listening to Us and Them. Our team for this show is me, Trey Kay, Samantha Gatzik, and Kate Smith. Michael Lipton and Tristan Lozow wrote and performed the Us and Them show music. Mark Lerner designed our logo. Lelena Price provides us with images for the web. The marvelous people at PRX and West Virginia Public Broadcasting make Us and Them possible. So do grants from the Corporation for Public Broadcasting, the West Virginia Humanities Council, and the CRC Foundation. This episode is supported with a grant from the Claude Worthington Benetton Foundation. Us and Them was originally developed with assistance from the mentorship program at AIR, the Association of Independents in Radio. We'll see you next time on Us and Them.
Support for this podcast comes from the Corporation for Public Broadcasting.
From PRX.